I'm Simon Wade. I'm a student of physical therapy. Today we're going to work on long-term patient positioning in supine. So, as instructed, we're starting with our patient in this position. Do I have your permission to work with you today and we'll adjust your position? Great. So we want to work on three things. Patient safety, make sure that they're not at risk of falling or obstructing their airway or anything of the sort. Prevention of ulcers, contractures, and edema. And then lastly, we're going to make sure we got patient comfort. So first thing I'll note is I don't have any bed rails or anything of the sort, but if I did, I'd want to put those up to make sure we minimize fall risk. But we do need to work on his positioning. So the first thing I'm going to do is pull away the second pillow from here, because that's going to over-flex his neck, and we don't want that, because that's going to shorten muscles and lead to contracture. Next thing we're going to do is we're going to ask our patient to straighten out. Can you bring your hips to center, and then bring your legs back to center here as well? Great, thank you. Noting that the patient had a tendency to sort of laterally rotate here, I'm going to make sure to use towels rolled up on the outside. I'm going to run them along the length of the femur, and this should help minimize the amount that his leg wants to externally rotate. I do also notice that we have pressure points here under the heels. If the patient is at risk of bed ulcers because they're immobile or hemiplegia, we're going to want to make sure we put something to relieve some of the pressure underneath the heels here. So I can place a pillow underneath the calves. In this case, I might even need a little more. Perfect. This is going to do two things here. We're going to relieve pressure from his heels. Also slightly elevating the feet is going to reduce the risk of edema. I've got his knees neutral and straightened so that they're not flexed and at risk for contracture here. Last thing I'm going to need to work on is making sure that if there was an immobile upper extremity, say his right arm, was suffering disability from the stroke, we would want to make sure that this arm is straightened. I can grab an additional pillow. This leads to a more neutral glenohumeral position here. And then sometimes we might find that their hand wants to naturally kind of curl and close here. So to prevent that, we can take a rolled up towel, place this under the wrist, and have them put their fingers over. This puts the wrist just slightly back into extension and allows the fingers to remain open. This would be a good long-term position, but to prevent sacral ulcers, we might have the patient move and adjust their position every couple hours. And that's everything. Thank you.